monthly meeting. If we can first start with our Office of Aging. Is he available? Dee, are you out there somewhere?
Can you hear me?
Yes, I can. Thank you. I can hear you. Thank you very much. Can I first of all get a motion to approve the minutes of our last meeting? Supervisor McGowan, seconded by Supervisor Shepler. Thank you. Our first request, as far as our agenda is concerned.
Can you please vote on the minutes?
Yes, I'm sorry. All those in favor?
Aye.
Thank you.
Don't feel bad.
Our first request is to fill our meal site manager at a base salary of $20,578 due to retirement, approximate savings of $2,561. Can you please give us some rationale for the request?
The current meal site manager will be retiring the end of the year, and it is a needed position, so we're just requesting to fill it.
Fantastic. Thank you. Can I get a motion to approve that? We have Supervisor McGowan.
I'll second it.
Thank you. Seconded by Supervisor Frazier. Thank you very much. All those in favor?
Aye.
Aye.
Our second request is to transfer $25,000 from part-time salaries and $15,000 from full-time salaries to cover the remainder of the 20 budget. Can we get some rationale, please, Dee?
Yep. Due to COVID, we've been providing more meals than we normally do, so our food budget has increased, as well as the cost of some food items have gone up. So we're just requesting to move the money from salaries into foods to cover those expenses. There'll be no additional burden on the budget.
Thank you very much. Can I get a motion to approve that? Supervisor Shepler, seconded by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Thank you. Our third request is to transfer $4,887.46 from DSRIP into Warren County equipment. Some rationale, please, Dave.
This will allow us to purchase 5 meal transporters due to the Chestertown relocation of where we're providing the meals. DSRIP is 100% funded, and this will use up all of the DSRIP monies that we have.
Yes, can I get a motion to approve this? Supervisor McGowan, seconded by.
I'll second that motion.
Seconded by Supervisor Frazier. Any discussion? All those in favor?
Aye.
Aye.
Number 4, to increase the contract with Hamilton County to $55,000. So some rationale, Dee, please.
Yep. We currently have 3 contractors that provide this service to residents in Hamilton County. 2 of them we haven't used for the entire year, so the other vendor is taking those clients on. So we just want to increase the monies to make sure that they can provide the services that are needed. This will be no impact on the budget either.
Can I get a motion to approve Dee's request? Supervisor Conover, seconded by Supervisor Bruno. Any discussion? All those in favor?
Aye.
Number 5, fill a meal site manager, Chestertown, due to retirement. Dee, some rationale, please.
Yep. The current meal site manager for Chestertown is retiring the end of this month. So we're requesting to fill that position. It will be an approximate savings of about $4,000 county dollars.
Wonderful. Can I get a motion to approve that? Supervisor Shepler, seconded by Supervisor Bruno. Any discussion?
Yes.
All those in favor? I'm sorry.
Sorry if I may, Mr. Chairman. And so that's to continue on with the reorganization. This new position filled at the hours of the management of the Chestertown facility will take into the reorganization of that site.
I'm sorry, I couldn't quite hear you.
Yeah. So with the intent to fill, do the resignation, for the Chestertown manager that will cover you for the reorganization of the meal site for Chestertown?
Yes, this does cover that change that we're making starting in 2021.
Okay. Which will then drop the cook and it will be just run by the manager?
Yes.
Okay, thank you.
We, I believe, have a motion on the floor. Supervisor McGowan, second by.
Nope, Supervisor Chapler and.
So we do have a motion.
Yes.
All those in favor?
Aye.
Thank you very much. As far as the discussion item, can you give us maybe an update?
Yes, so unfortunately, we received news from the New York State Office for the Aging that our funding would be reduced. So instead of getting 75% funding reimbursement on certain items, we're only going to get 80% of that 75%. So basically, if we were getting $100,000 reimbursement, normally we would get $75,000 back. Now it will only be $60,000. And this was made effective for any expenses incurred after November 1st. For this year, we will be fine because we had COVID stimulus monies. Next year is a different story, though. If this continues, we could potentially have to make up about $230,000 out of county monies, which we were not anticipating. And just to give you an idea, if we were to make up that difference with all of our programs except for the nutrition programs, which is the meals, we would have to cut over $600,000, which would basically be pretty much our entire budget. If we were to do it out of the nutrition program, it would just be the $230,000. So unfortunately, if this continues, we may have to make some cuts to our nutrition program in 2021.
Any comments or discussion on what Dee has just said? It doesn't appear to be terribly pretty, but we guess we'll take it one day at a time. Any discussion? Seeing none, we thank you very much, Dee. We thank you for your efforts and happy Thanksgiving.
Mr. Chairman?
Yes,
Mr. Chairman?
Yes, go ahead. Ron.
Mr. Chairman?
Yeah.
Before you,
Ron.
have I been recognized? I'm not sure.
Yes, go ahead, Ron. Yes.
Dee, I know we're going to be delivering a lot more frozen meals in the coming year, and I just want to say that I hope that we're going to keep a very watchful eye on the quality of those meals, and that hopefully our standard doesn't decline, and if possible improve. I know you have a good focus on this, but maybe quickly, you plan on changing any of your monitoring? Because I know you're going to be delivering a lot more frozen meals.
Right. We currently we send out satisfaction surveys to the home delivered meal clients, so we'll be relying on those. We also check with all of our clients at least twice a year that are receiving home delivered meals. And at that point, they can give us updates on the quality as well. And definitely, if we see an issue, we will be addressing that.
Thank you.
Thank you very much, Ron. Any further comments or observations? Seeing none, thank you very much, Steve. Appreciate it.
Thank you.
We can now jump over to mental health. And Rob, are you available?
Yes, I am. Good morning.
Good morning. Thank you. Basically, looking at your agenda here, your first request is to reappoint Warren County Community Services Board member. Can you give us some rationale, please, Rob? Did you hear me, Rob? Rob?
Okay, the audio was cutting out there, but I think you want me to go ahead and proceed.
Okay.
Okay, that sounds pretty good. So basically, did you indicate that you wish to approve a new term for Kimberly Braden, PhD. Is that what you just said, Rob?
Correct.
Okay, that being said.
Correct. These are 4-year terms.
Great. Thank you very much. Can I get a motion to approve that request? Supervisor Chapler, seconded by Supervisor Frazier. Any discussion? All those in favor?
Aye.
Our second request is to approve the 2021 Warren County Community Services Board contracts for ongoing community mental health, addiction recovery, and developmental disability services. Can we please have some rationale, Rob?
Sure. I apologize. The connection is not that great. This is something we do annually to approve our contracts with our various contract agencies, not-for-profit agencies in the community. There's an attached Schedule A that shows the agencies that we work with and the amounts for the contracts not to exceed. These are usually annual contracts. So that is the request for 2021.
Can I get a motion to approve Rob's request? Supervisor Conover, seconded by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Our third request is to amend Resolution 560 of 2019 regarding compensation for psychiatric experts performing court-ordered examinations. Some rationale, please, Rob.
Sure. So these are, again, as it mentions, court-ordered examinations. I am court-ordered by various courts to arrange for these examinations. They're the competency to stand trial examinations. It requires either a psychologist or a psychiatrist, and we need 2 examiners for each order. And sometimes we need 3 depending on their outcome. Always in the past, we've paid these on an hourly basis. And this year we learned that we really needed to have contracts with the examiners, which we never had before. And the way the contract was written was $175 per exam and per examiner. However, always in the past, we've paid this at an hourly rate because there are times when an examination and the report write-up will take a little bit longer than an hour. And also we've reimbursed the examiners for travel to either to our jails to conduct the examination. Sometimes they're conducted in the jail. And then also, if they're subpoenaed to court, we have to pay for their time to go to court to testify. So the request is to amend the resolution to read $175 an hour, and to amend the attached Appendix A to remove the not to exceed amounts per examiner. And this would be retroactive, so for the year January through December 2020.
Thank you very much, Rob. Can I get a motion to approve that? Supervisor McGowan, seconded by Supervisor Conover. Any discussion? Seeing none, all those in favor?
Aye.
Aye.
Thank you. Request number 4, Rob, request to amend the 2020 Warren County budget to allow for the purchase of 6 laptop computers. Warren County will be reimbursed by Washington County for 1/2 of the expense for the annual chargeback mechanism. Can you please explain, Rob?
Sure. This request, because this year we do regularly budget for equipment purchases and to keep our computer equipment up to date, we usually replace 2 computers a year. Those are our desktops. We have 6 staff, so that's a 3-year rolling basis. And then on the 4th year, we've replaced some laptops. However, this year, of course, due to COVID, we have been in austerity spending measures, and we've postponed any purchase of any computer equipment. However, in our budget meetings this year, we were talking about the planning for some purchase next year. However, the issue was raised, well, what about using something like district funds? And we did receive some additional district funds this year. In fact, more than anticipated. And attached to the resolution request is an attachment A table that shows that we had budgeted, anticipated $10,000 in revenue from district, and we ended up receiving $30,698. So I thought maybe this will be an opportune time to use some funds that are not county funds, and to catch us up on purchase of laptop computers. This would also allow for our staff, in the event that we have to go remote again, then all of our staff would be able to work and perform all essential work functions remotely.
Thank you.
Also, the comment just on the chargeback mechanism, Washington County does pay half of our expenses, so half of the 3708 would be reimbursed by Washington County through the chargeback.
Thank you. Can I get a motion, please?
I'll make that one.
Supervisor Frazier, second by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Does anybody have any comments relative to any of the issues relative to Rob's enterprise? Seeing none, thank you. We have no referral items. So Rob, I want to thank you very much for your efforts and wish you a happy Thanksgiving. Thank you.
Thank you.
Thank you. Now looking for Janelle, or are you in the house, Janelle? I'm looking for Janelle Jones. Are you available? Janelle? Is Janelle Jones available? Okay, thank you. Apparently she's on her way. So that's
We're a little behind schedule.
She's got work to do.
Oh, you want me to speak at the beginning?
Marty. Thank you very much, Janelle, for your attendance this morning. Looking at your submissions here, your first request is to authorize a contract with Karen Fine, a licensed clinical social worker, to provide services for preschool program at the established current rates, including automatic renewal, unless there is 30 days written termination notice by either party. Can I get a motion first to get this on the floor? Supervisor Frazier, second by Supervisor Shepler. Any discussion, please, or rationale? Or,
We continue to need service providers to serve departments in our pediatric population. We have to have the capacity to accept referrals and provide these services. These preschool services are billable and revenue generating, and CPS services receive a 59.5% reimbursement.
any discussion, any comments by any board members? All those in favor?
Aye.
Thank you. Request number 2, resolution 2, to amend the health services table of organization to delete the public health program manager grade 21 annual salary of $50,816 and create the business specialist position grade 18 and an annual salary of $46,492. Can I first of all get a motion to get this on the floor? Supervisor McGowan, seconded by Supervisor Conover. Discussion, please.
We had a resignation of our public health program manager back in June. And since then, we've worked with civil services and human resources to create a position that better fits the needs of our agency as we go through changes. This position will be tasked with our electronic medical record grants, our business management, and contracts.
Any discussion? All those in favor?
Aye.
Resolution number 3, to approve filling full-time business specialist grade 10 annual salary $46,492 effective 12/21/2020. And I first of all get a motion to get it on the floor. Supervisor Conover, seconded by Supervisor McGowan. Some rationale and discussion, please.
Like we said above, this position is tasked with our agency's electronic medical record grants, business management, and managing our contracts. This position will be eligible for state aid reimbursement, which is at 36%.
Any further discussion? Go ahead.
That 36%, is that minus the 20%? The New York State has done that on reimbursing that, or?
I don't think so. We get a base grant of $500,000, and then anything above that are expenses get paid back at the 36%. I don't know, Tom, do you have a better answer?
No, I believe so. We're telling the state aid. Yeah. I mean, we haven't seen anything yet on the 20% with the state aid, because this is our state aid.
Odd number, usually it's 40 or 50 or 60.
Oh, it's been that way for
36.
years. After you meet your total amount, then it's 36% after that.
All those in favor?
Aye.
Thank you. Request resolution number 4 to approve filling full-time registered professional nurse grade number 39, grade 19, at an annual salary of $47,523, which is vacant due to a resignation on 11/17/2020. And I first of all get a motion to get it on the floor. Supervisor Conover, second Supervisor Bruno. Discussion, please.
Yes.
The rationale, our nursing position is needed for our department. We're in continuous recruitment, and this position's revenue generating dependent on the caseload of the nurse and insurance reimbursement of those patients.
Any discussion by any board member?
Mr. Conover.
Supervisor Conover.
Mute.
We can't hear you, Ron.
How does it look, your ability to find a nurse? Are you concerned about that at all?
We actually have a nurse that we interviewed last week for another open position, so we're hoping to be able to fill it.
Oh, excellent. Thank you.
Good, thank you. All those in favor?
Aye.
Thank you. Resolution number 5 to approve filling part-time public health assistant grade 10 prorated to $18.09 per hour, a position created in the 2021 budget effective 1/1/2020. 2021. Can I first of all get a motion to get this position on the floor? Supervisor Conover, seconded by Supervisor Frazier. Thank you. Janelle.
This position was approved in the 2021 budget, and we need authorization to fill the position. Works within our emergency preparedness program.
Very good. Thank you. Any discussion? Seeing none, all those in favor?
Aye.
Aye.
Thank you. Resolution number 6 to approve filling full-time senior account clerk number 3, grade 7, with an annual salary of $33,600, approved in the 2021 budget, effective 1/1/2021. And I, first of all, get a motion to get it on the floor, please. Supervisor McGowan, seconded by Supervisor Conover. Discussion, please.
Again, this is a position that was created in our 2021 approved budget, and we just need authorization to fill the position in January.
Very good. Any further discussion? All those in favor?
Aye.
Aye.
The what are we on? On 6 or 7?
Resolution number 7.
Number 7. Thank you. You authorize carrying over all remaining 2020 accrued leave balances as of December 31st, 2020, including vacation carryover, float holidays, personal time and days in lieu of, with the exception of cancer screening, to 2021 accrual balances to be available through 12/31/2021 for Assistant Director of Home Care, Assistant Director of Public Health, and Director of Public Health and Patient Services. Can I first of all get a motion to get that on the floor, please? Supervisor Conover, seconded by Supervisor Bruno. Thank you very much. Janelle.
Just with our response for COVID and the pandemic, our administrative staff has not been able to use any of the time. We're just asking to carry that over. Typically, when time's carried over, it has to be used by June, and I don't know if that's going to be a possibility. So I'm looking for that flexibility to make it through through December, and hopefully have our pandemic taken care of. Then we'll be able to utilize the time next year.
Yeah, we basically once in 100 years we are faced with an issue like this, and we have employees that step up to the table, senior employees, talented, qualified people, and we certainly, I think, we certainly should hopefully support this effort. So, have we put a motion on the floor yet? Yes, we have. Any discussion? All those in favor?
Aye.
With honor, yes.
Press number 8. On.
Okay, attachment number 8 is a budget amendment to bring forward our BT budget runs from July 1st to June 30th of next year. So we're asking kind of to tap into next year's for our our part-time person in that program. I'm asking for $1,500 in salary and then some fringe related to that. And that's all going to go within, again, it's billable 100% to the BT grant. So we're asking to amend the budget this year just by that amount, and then also the revenue will reflect.
Thank you. Can I get a motion to get that on the floor? Supervisor McGowan, seconded by Supervisor Scheffler. Any discussion? All those in favor?
Aye.
Resolution number 9.
Okay, another budget amendment, same program of bioterrorism. We didn't fill the liaison position. The last grant started again July 1st of 19 and ended June 30th of this year. And so when we hired our liaison at the beginning of this year in January, those funds are still in there in the BT grant. Figure about $10,000. Well, we hired right as soon as COVID started 2 per diem people, got right on it, and so we want to move that money into, again, amend the budget for their time, which is just from about April 1st to June, during that last quarter of the grant. and move that money over. And again, that's fully reimbursable by the UT grant.
Can I get a motion to get this on the floor? Supervisor McGowan, second by Supervisor Conover. Any discussion? All those in favor?
Aye.
Number 10.
Do you want to do your other stuff first? Before I do financials or no?
So we have 3 discussion and/or resolution requests, and I don't know when it's most appropriate to do that within the meeting.
Why don't you just go ahead then? Yeah.
Okay. I'll do have a few papers. So the first is a resolution request to authorize health services to mend all insurance agreements like managed Medicaid, managed Medicare, commercial insurances upon approval of the county attorney's office based on New York state and federal cuts and increases. These changes are out of local control and the agreements have to be maintained to ensure our payment of services. What happened is when Supervisor McGowan mentioned the 20% cuts, and we've experienced some of that in our managed Medicaid and managed Medicare type programs, every insurance company sends us things that we have to sign acknowledging that they're taking out that 20% rate. And I don't know if you want each and every one to come through the committee or if you want maybe the county attorney's office to work with us and give us that authorization. Right now, our current authorization has that we can enter a contract or amend a contract or change a contract if it's less than 5,000. And in this case, it's not an increase, it's a decrease. So it wasn't really covered. So I'm just providing a suggestion that we do something where we can work with the county attorney's office to be able to do that, but I'm open to whatever you think I need to do with that.
Anyone?
Brian?
Go ahead, Ryan. Yes, sir.
I'm just trying to better understand mechanically what the consequences of this are. Does this mean providers that we have contracts with getting less reimbursement from those programs?
One example is, let's say you have insurance A, and insurance A sends us an amendment of our agreement with them that's to manage Medicare that we provide services to in our home care agency. We're still providing services for that patient. We still need to get paid for that. They're just telling us that due to federal cuts, that they're cutting 20%, which means they're getting cut, which then they bring that down to us. So that means that when we charge for that service, we're going to get 20% less, and we have to acknowledge it. If we don't sign it, then we don't get paid for any of it. So we can investigate this further and maybe run it through another committee. We have some that need signatures, and I wasn't sure how to proceed with that.
That's about tying your hands, huh?
So this is about us getting paid less. Do we have any idea of what the time frame of this is going to be, or how much it's going to amount to?
I don't. We can pull a report for that, but I know all these insurance companies want their signatures by the end of December because it affects January.
And it's just something that just came down.
We can try not returning it, but I'm just scared they'll say that because we didn't sign it, our contract's not up to date, and then they won't pay us, and we won't get what we can get. We can table it if you like and run it through another committee after we do more research. This was my last opportunity to kind of shove it in there, so I wasn't sure what to do.
I don't see us as having a choice. It's what if the committee is comfortable approving it, not knowing what the financial impact is going to be, or if you want to send it to another committee where we can have maybe some of those details. But either way, we have to approve it.
That being said, why don't we have a motion to approve it as it is presented? Would anyone like to make that motion, please?
I'll make that motion.
Thank you, Edna Fraser, seconded by President McGowan. Any discussion?
We can always amend it if things change, right? you know, but this keeps us ahead of the ball. Because like I said, it seems like everybody's got the old axe out, and 20% seems to be the common number on everything.
Supervisor Conover, I see your hand up.
Thank you, Mr. Chairman. Ryan, if I'm hearing this correctly, basically it's that they want us to certify, if you will, that we're aware of the fact that this might cost us more than what's historically been the case via the contract. But I'm not sure I heard. I think you were asking the question. What's the order of magnitude? Did we get an answer to that?
No, I don't think we have the answer to that because this was just sprung on us essentially. So maybe what we do if the committee wants to approve it is we also have a report attached to it. When we figure that out, we can bring that to finance.
Yeah, I just or just make sure you send it out to the committee, I think. But other than that, I agree with the county administrator. I don't see where we have much choice here, do we?
I'm good with that one. Or we have to vote.
Yes, all those in favor?
Aye.
Aye.
Thank you. Thank you very much. Appreciate it.
Sorry, it was all good news today. My second one is a resolution request to amend and or rescind our current immunization action plan grant to remove the additional influenza funding of $14,105 and enter that into a separate federal contract that is the LHD support for flu and COVID-19 response for the same amount. This is reflected from our resolution request, or resolution 307 of 2020. And that went through the administrator's committee. And what had happened was the state had said, hey, here's this $14,000 extra in funding. We're going to add it to your IAP grant, which is our Immunization Action Plan grant. And just at the board meeting on Friday, I received notification while I was in the board meeting, actually, that that was state funding. So they now want to take that out of the IAP grant and do a separate grant with federal funding and the same amount of money. So it's not changing the money. It's just basically changing the grant from it being added to one to a separate grant. And then it's going to obviously kind of trickle in different codes and whatever. But I'm not sure if I'm amending or rescinding the current Immunization Action Plan grant to remove that funding so that a separate grant with that funding can be put in there. So that's
Question?
Yes.
That now will include both the COVID and the flu for the same amount of money?
I believe that with us encouraging flu vaccination to help with the COVID scenario, thinking if people have COVID and flu, that's not going to be good for an outcome. So the money is basically being used to support the education and the outreach of encouraging people to get vaccinated.
Thank you.
So
Thank you.
to answer your question, yeah, it's kind of together. But.
Thank you. Can we get a motion to amend and or rescind the current immunization action plan? Supervisor McGowan, seconded by Supervisor Shepler. Any discussion?
Mr. Chairman?
Thank you. Thank you. Supervisor Conover.
Yeah, just so I understand this, we're basically, if I heard it correctly, we're basically taking expenses that would have been attributed to one category and move it to another category. I guess, do you have a sense, is there any impact to the county budget, or is it pretty much a wash, if I heard that correctly?
It's a wash.
It's a wash. In September, when we asked, we just got notified in September, right after our last committee meeting, that they were giving us the $14,000. So that's why I went through your board meeting in September, and I've already amended the budget. But now that they've come and said we don't want it to be state aid, it's gonna be coming from federal, and they just notified us that that's the exact same amount. And I'll, Rob Lynch created a new GL account so we can keep track of this separately, and also the revenue account, which will be in my attachment 10, but is a different revenue account that will now be a revenue from federal, I'm sorry, not from state.
Okay, thank you.
Yes.
Okay, I think in this situation, basically what happened was back in September, the Health Services Department gave notification that they were going to get an additional $14,000, like $14,005, I think. So there was no amended contract, to my understanding. What happened is simply a budget amendment to amend both revenue expenditures under the current IFD grant. So what I think needs to happen is I think we need a new contract for the new grant, and then they'll simply move the money from when they put it in IFD to the new grant, using the new budget codes that are created. That makes sense?
So we're essentially taking money that was already placed in the budget, moving it to somewhere else in the budget, and authorizing the contract for it to be spent.
That's the other piece, right? So the money's already in the budget because it was put there in September. You're just moving that code, the newly created code. What I think we're missing is we were just noticed that it's a new contract, a federal number of contracts. So I think in that case, you would need a new contract.
Thank you. Said, all those in favor?
Aye. Just to be clear, do I need to rewrite anything or submit anything, or?
We'll work with the county attorney and the clerk of the board and Tammy, and we'll get it all right for the memos.
Right. I appreciate all the help with these miscellaneous items. I have one more.
I'm sorry. Yeah, it's tough when they come up at the last minute with all that DOH is doing. I think that under normal circumstances, DOH should probably be doing a better job at it.
I'm going to try to make this as simple as possible. In March last year, we were given a grant, so let's call that grant 1. It was a COVID grant that would allow a lot of different COVID-related expenses. And at the time, if you remember, I put in up to 10 per diem public health assistant positions to help me with contact tracing and things like that. Those were new positions that weren't included in the budget. Sometime through the whirlwind of the summer that we had, but in August, we were made aware that we were going to be given another grant, which we call the ELC or ComCare grant, which is more on investigation of cases and contacts. And that's a very prescriptive grant that will only cover staffing related to contact tracing and case investigations. And those positions that can be funded by that grant could not have been in the 2020 budget already. So Ton and I met with the state. We asked and said, can we use these newly created positions from March, make it go to July 1st, which is when this grant starts, which is actually July 5th. And can we go back and claim these? So we'll take them out of grant 1 and put them in grant 2 so that we can use grant 1's money for more things like moving the testing trailer and things like that. They were totally on board with that. And we jumped through the hoops that we were told that we had to jump through. And we recently, when Ton submitted a budget modification request to the grant, they denied it, saying we were out of compliance. I'm still in the process of working on whatever their compliance issues are with this ComCare, but I'm not ready today to make a transfer, but depending on what the outcome of my pushback to the state is, we might need to be moving money again before the next board meeting. So I'm just making you aware of that as to how that goes. But what we're trying to do, and Ton was an estimated like $75,000 worth of expenses of staff that we're trying to transfer.
No, 38,747 and 1 cent. To be exact.
Sorry. Ton's the money person.
Not back to March. This began July 5th. Basically what it is when we talk to the state, like she said, the new ComCare, we call it grant, is supposed to be primarily, like she said, salary and fringe. So I they said we could go back to the beginning when it started in July and move that money they suggested to this new grant. So I went back and did a calculation, all the payrolls from that, and that's what it totals up with fringe, about almost $39,000 that we can get out of that grant and move it to this grant, which would be great because the first grant we got is down to almost nothing. You know, we've utilized it. So, and that's where it catches all, any PPE stuff, like she said, anything else we needed to get, the trailer, all that has come out of that first grant. But since this last one is just salaries, the state suggested, okay, then just take the salaries for these, only those people who are, by the way, it's got to be new employees. It can't be all our staff that's working on COVID, none of their overtime, none of their extra time can go towards this new grant. It only could be new employees. So I could only go back and take those that were the contact tracers. So in doing a whole spreadsheet for the 4 months or whatever, that's what it comes out to right now. And Janelle's still got to fight the fight with the state as to doing it. So that's why we didn't request it. I did write up a transfer just in case, but as of today, she hasn't been able to get me.
Yeah. You don't like other committee things, but this is one that's brewing.
So we don't have to take any action. We're just going to play it day by day. And
unless you want to authorize any action to be able to do it if we get the go ahead. But
I just would give you the discretion there.
Mr.
Supervisor Conover.
Yeah, my sense here is that our folks have done such a tremendous job keeping our costs under control through this whole COVID experience. And really what they're reciting here is their intention to continue to try to do that. My sense is, I think given how fluid this is, I would be willing to propose that we authorize the county administrator to advance when he finally has the numbers to finally advance this to the board. If it has to go to the board, let him advance it at the appropriate point in time. They're looking out for the health of the community, and they're looking out for our financial condition as well. I would authorize them to do that if so that at least it went through our committee with some type of action. That would be my recommendation. I don't know, Ryan, what do you think?
Yeah, hopefully we'll have enough feedback from the state and we'll have enough finality to bring it to finance. I would hope. Finance is when, next Thursday. So let's shoot for that. And if we can't do it, then, you know, maybe we can meet again or whatever really the pleasure of this committee is. Starts here.
But we can, whatever your recommendation is, Ryan, let's just run with that.
Janelle, you think we'll be ready by finance?
no, I tried to meet with the right people on Friday, and I'm trying again today, but I'm not letting it go. So right. I should have an answer.
Let's try by finance. I'll at least give a report at finance on where we're at, and if we need to, you know, if we need some more time, we can figure it out then. That works.
Works for me.
Okay. That's fine. So we don't need a motion to. Great. Sounds good.
Tammy, that works for you?
Yes. So now we have our information.
Okay. Number information for discussion and review.
I think we missed the transfer.
Yeah, just number of attachment 10. That's my fault because I went ahead of Janelle. I thought we were going to do it after, but the attachment 10 is, again, transfers, budget transfers within our full agency. The first one is our bioterrorism. Again, just I need a little bit more money for our coordinator. So I'm moving the, what is it, $1,560. Looking again with the rent or with the bioterrorism grant, a lot of the money we haven't spent because we haven't been able to do anything, but it's been primarily people's salaries. So I'm moving it out of rent, food, and contract expense over to full-time salaries to pay for that. My second one is if this happens, but I still want to move the money. So if this ComCare does happen, the money is already moved because I already asked for this. We had put full-time salaries of $25,000 in when we amended the budget. but we're not gonna be able to fill that position before December 31st, and they're sure not gonna make 25,000 in the next month. So I just want to take that out of full-time salaries and bring it down to the part-time salaries where a lot of this money is gonna go when I move it over. So I want to make sure there's enough in there. I will say it was like $256,000 for like 2 years. And I had put in for this year's budget 150, which we won't spend 150, but I got to make sure when it hits salaries, it's in the right category. So that's the second one. The third one is what Janelle was talking about with this new IEP grant that's going to be federally funded. Again, it's just a mirror image of moving it where I put it in September to where it's got to go now with the new GL codes. One thing I do have to bring to your attention, because I was just given that this morning, under the revenue code for the 14,105, I have 3407 on this report, but I was told this morning it will be the last four numbers will be 4409, and that's because it's a federal funds that we're going to get, so the number has to be different, and it will again be with this new grant. So I just need to note that, and rather than reprint, Amanda just said I just needed to note it, that code is going to go the last four digits from 3407 to 4409, and that should take place of that too when that all gets approved.
So number 3 on here corresponds to Janelle's second request just now.
Yes.
Okay.
Yes, the IEP grant. I was supposed to probably do, well, it doesn't matter, I guess. It's probably better that she explained it first before I gave you this, but yeah, so this is just to move that money within.
Great. Thank you, Tom. Can I get a motion to transfer the funds in 2020? Supervisor Conover, seconded by Supervisor McGowan. Any discussion? All those in favor?
All right.
Okay, now it's on to expenditures, which is attachment number 11. This was as of November 15th, giving you some idea. We are working on closing our October numbers right now with our home care. I did approve a few grants, our WIC grant and our Children's Special Health Care Needs grants in our revenues. Again, you'll notice the salaries down at the bottom where we do the comparison, and you'll see that at this time we're 70.39% of the budget compared to last year. At this time we were at 85.66% of the budget. One of the things I do like to know is how much of this that we're currently in, even though we're below budget, which is great, but just let you know, of the overtime salaries in total for the year, almost 25% of it is related to COVID and everything with that. And also to note that the part-time salaries, 14% or over 42,000 is related to part-time, which is a lot of the per diem that we had to hire for contact tracing. So that gives you an idea of where we stand. And then on the attachment 12 is again the comparison of last year at this time to this year. Again, the salaries I just talked about. Equipment, since we last met, we did finally get our car in, so that's the big difference in between equipment from last year to this year. Contract expenses, again, they're down because expenses down because we are still waiting for some bills to get paid. Our current transportation, they're being held right now just because of that, but I think we're in the middle of signing that contract. So those invoices will be entered soon and reflected. And of course, by year end, we'll have everything in that we need to. Revenues again are below. I'm still waiting, which I said last one too, for the state to let us bill for our 1920. We haven't been able to bill that yet because they still haven't said they've had the money to pass. So we're still waiting on approval for that. And our home care, due to elective surgeries in the beginning, our revenues were down, like we said in the beginning of COVID. They're starting to catch up a little bit now. And also, one thing that we talked about too is that we haven't had any clinics really since COVID started. We just had 4 rabies clinics, and 2 in October, 2 in November. Not a lot of money, but again, that's something. And then of course, Janelle talked about the flu clinics that we're going to start with that too. So that is a little bit of revenue. And also because those nurses have not been working the clinics, that's where we saved a little bit on sale. And that's all I have.
Thank you very much, Tom. Yeah.
So we also have the referral status on your attachment 13A and 13B. Looking at where we were last year, not much difference. And, you know, like you said, with COVID, it's been kind of an unpredictable I do know we were one of the few agencies that visited throughout the COVID pandemic. But kind of what we have. Any questions, I'm happy to answer those. But. And then we have our emergency preparedness report with all of our activities on attachment 14. And then our rabies report, and like Ton mentioned, we did have 4 appointment-only flu or rabies clinics, and those actually went very well. We did them just so we can monitor the flow and social distancing. We're hoping in the spring to maybe offer some more, or February, March, to offer some more to try to hit the North Country. We just due to timing and staffing could really only offer them down here, but we did have participation from all over the county. So that was good. I don't have any meeting authorizations. I didn't have any referral or pending items.
Does anyone have any comments, discussion? Don Lehman, any comments? Your system?
Hi, Chairman McDevitt. No public comments at this point.
Supervisor Conlon.
Yeah, thank you. Ton, what do you think we're going to end up in terms of total revenue? Will we get anywhere near 4, or what's your sense on that?
Well, obviously our clinics and our public health, we won't, but again, we don't have the expense. As I say, if we don't have the expense, usually we don't have the revenue. Our home care, yes, we did lose some, obviously, in the beginning of all of this. It's catching up, definitely. They're busy. Will we meet our what we budgeted for? By no means. With COVID, that happened. But at the same time, our expenses were down. We didn't have our per diem coming in to help. That was quite a few months there, and they're just starting to come back. So no, I do not think we'll meet the revenues, but I do not think we'll be those expenses either.
Okay, thank you.
One of the items, on here is a COVID-19 update. Is that, Janelle, do you have anything that you can add to that, or I think we're entering a new scenario here as the weeks go by here with vaccines coming down the highway here, and the distinctions and variations of various vaccines. I'm sure it becomes a challenge for your organization, I would think. But as far as any COVID information, do you have anything that you can add?
Well, I know that I spoke at the Board of Supervisors meeting on Friday, so I won't reiterate a lot of that unless people would like me to. We've been actively working with our schools so that when and if, and hopefully not, they end up in the yellow zones, that we're able to provide testing support for them. We're working on deploying rapid kits to providers so that everyone's provider would have access to that, meaning all patients would have access to rapid testing should they be symptomatic. With the vaccination, our agency submitted a vaccination plan for review by the State Health Department and how we'd implement that. So we're kind of waiting for feedback on that plan. In addition, I know Supervisor McDevitt has asked about the freezer storage capacity. It's quite a specialized freezer. The containers that we're being told that the vaccine comes in will keep the vaccine for up to 15 days. And part of our plan was how we were going to push out and be able to utilize the supply that we're given within that period of time, recognizing that every county can't run out and go get a freezer. They may or may not be available, or we're back ordering and things like that. I will say that we've been looking at products, and Tom thinks she can find us the money in our department if we need to, and we're able to buy something or we need to buy that. But we've asked for guidance through emergency preparedness and the immunization program as to what specs we need for this such freezer, and just so that we're not buying the wrong thing. And we'll be working with our partners, the hospital and Hudson Headwaters as well, because it's not just us that will need to store that. So that's what I have for COVID, unless there's other questions.
Questions on the part of any committee members? Seeing none, move on.
Okay, so another thing I wanted to bring to your attention, on October 26th, on Monday morning, bright and early, the State Health Department came and did a survey of our home care agency. It was a recertification visit. Overall, it was an excellent survey. They praised our staff, Val, and our home care staff did an amazing job satisfying their requests while they were here on site for the 3 days. They reviewed our COVID plan and our procedures, and they mentioned the word perfect to describe that. We did have citations. All of them were minor. An example would be like for infection control, we have a pulse ox. The nurse cleaned the pulse ox, but didn't clean the inside of the bag. So we were cited for that. We had a staff member that works for us as an employee that also contracts with us to work with our home care patients. And we had used a lot of the documentation, like references and things like that, you know, because we obviously wouldn't have put her in another capacity if we didn't think that she was doing a good job. And we got cited that we didn't have one of the references, and they didn't like our orientation because they didn't count the double orientations. So we had a few little things like that, but probably most important to bring to the committee, because we had talked about our electronic medical record at our last meeting, is we did receive a couple citations related to our electronic medical record. One of them is the plan of care. Whenever we do safety education or teaching or this, that, or whatever, it has to be able to flow to this plan of care that goes to the doctor to be signed. We, looking at our medical record, had no idea that this wasn't being pushed. I mean, the data was being put in the system, but it was out of our control that it wasn't being pushed on this document being reviewed by the providers. And when the surveyor's here, they're only looking at what's going to the providers. They're not looking at what's in the computer. So they cited us for that. And one of the other things reviewed that we received a citation on was like for nursing practice. For example, LPNs are not able to make assessments, but an electronic medical record, before you can get out of a screen, you have to talk about the wounds. And we've now like got drop down, you know, things or whatever that we've kind of done a workaround for that, but it certainly was the system that kind of created that. The nurse and LPN knew that they couldn't make the assessment, but in order to get through the visit, they had to pass through that screen, even though they were, I think, just saying none or something so that they could get through that. But I just wanted to bring to your attention that we did have a survey. We did have some citations. We submitted our corrective action plan on Friday. So we're waiting for feedback on that. But overall, it was an excellent survey that the state told us that we had. I also wanted to give you an update on our electronic medical record. We've been working with Ryan Dickey in the county attorney's office. He's been really awesome in helping mediate between us and the vendor. We met with the vendor on the 13th, of which Ryan Dickey attended, in addition to our nursing supervisor. We advised of all the issues. We advised of the findings related to our survey. And we have to now provide the opportunity for the vendor to fix those problems. And so we're kind of in process. Not moving as quickly as we'd like to, but we are in process, and hopefully we'll keep moving from that regard. We've already talked about the COVID-19 update, and then just to move on to flu clinics, I'm excited to say we finally have a flu clinic schedule that we've got posted thanks to Don Lehman helping us out. I'd like to just remind supervisors that we have our employee clinic tomorrow. The registration for that is online, and it is, the deadline is midnight tonight. Part of that's because the state's now tweaking that a little bit, and it won't be available from a state perspective. But we also have to be able to use that information to do our clinic to make sure that it's socially distanced. And the good news for that is we're mimicking a clinic as a drill as well. So we're getting drill activity for that through our emergency preparedness program. And then the other thing is we have 3 flu clinics for the public that are appointment only scheduled. And we've posted information on those. So if anybody has any questions, I'm happy to answer it. Otherwise, I'm good. And I appreciate your patience with my late breaker items. I tried to have all that ahead of time, but it's impossible this time.
Being said that, any further comments by any board members, committee members? Seeing none, I maybe just as in ending up our meeting, I as chairman, and I think I can speak for members of this committee, we may be very well moving into maybe uncharted waters as we go forward here. Although the past year has probably been, significantly uncharted, but I feel 100% confident in our public health nurses to carry us into the end zone, to get the job done as they always have in such a outstanding fashion. So as we move forward, we again thank you for your efforts. That being said, any further comments by anyone? Seeing none, would someone please give me a motion to adjourn? Supervisor McGowan, second by Supervisor Frazier. We are adjourned. Thank you very much.